Hello my dear students, today we are going to see the third step or the phase of nursing process. If you remember, we had completed the two main steps of nursing process. The first one was nursing assessment. Next we just started with the nursing diagnosis and we completed that, and today we are going to see about planning. Okay, so let us start with that, and before that again short introduction about our nursing process. We had seen about assessment, nursing assessment, that is we have to collect the subjective data, objective data from our patient, and then we are going to formulate the nursing diagnosis according to the Nanda. Okay, Nanda has given the different nursing diagnosis. According to that, we are going to formulate with the, if you remember the format which I had taught you about, PES format. According to that, we are going to formulate the nursing diagnosis. So always we write first the label, related to is the main etiology or the cause, and then we write it down as evidenced by, that is the signs and symptoms. Okay, this is the format which is there for writing nursing diagnosis. So let us start now with the planning, and then we'll end with the nursing process. That is the last two step you can see, that is implementation, evaluation. So we had completed this two. Today we are going to see about planning. Okay, so planning is nothing but the third step of the nursing process. Okay, so it is when the nurse organizes a nursing care plan based on the nursing diagnosis. Let us understand what you mean by the word planning. Okay, planning you all must be doing at your level. Means, for example, if your friends are planning for a picnic, okay, so if you all are planning, your friends are planning for a picnic, so it requires nice nice thought to it, that which area, or we can use the word brainstorming, where we are going to think about different places nearby, or it can be in a different state or country you can plan out. Are you understanding? So planning requires a big effort, okay, to think what has to be done. Now when you plan, just an example, when you're planning for a vacation, you're planning for a picnic or something like that, you will be thinking about how much budget has to be spent, then what I will be doing there, what all the other different area. This is how it goes on, right? The same thing here also. When we are planning for the care for the patient, okay, we have to plan. We just don't rush in a decision and try to do some procedure. No, it is on the basis of the assessment and the nursing diagnosis which you have planned for your patient. Then you have formulated your nursing diagnosis. On that basis only we will be planning. Okay, we will be planning the intervention, we'll be planning the goals, we'll be planning the expected outcome. Okay, so here in planning, what we are going to study is the first one, the goal. Okay, now what do you mean by goal? Okay, if you remember, you must have made goals when you were in 12th standard, that I want to pass 12th with this much percentage. The same thing here also, like now you are in a first year or first year BSc, so you must be thinking that I want to achieve at least 70%. When you have a goal of achieving 70% mark in first year BSc, that is, you are going to work on it. Okay, so same here also, you as a nurse, you are going to prepare a goal, and then from that goal you are going to prepare a desired outcome, and from the desired outcome we are going to prepare the intervention, the nursing intervention. Interventions are nothing but the care which I want to give to my patient. Okay, we are going to study this in detail. So I've just said that, remember, we are going to plan it out, the nursing care, only and only on the basis of the nursing diagnosis. Remember this. Okay, nurse and client formulate goals to help client. Now this is the next thing what we do is we formulate goals, and goals are nothing which you are only going to plan. You're going to collaborate, or you're going to work with your patient, your client and the family members, and then plan the goal. Okay, expected, this is what I was saying, I am going to also plan it out, the expected outcome. Now what do you mean by the word expected? That is, I expect that this should be the outcome of my patient. Outcome is the result. Expected outcome means this is what I want to achieve. For example, if the patient is having fever, then what I formulate the expected outcome is, client will have temperature 100 degree Fahrenheit after 1 hour. Now this is what is my expected outcome. I am expecting that after my intervention, my patient's fever should reduce. He must be having 1 or 2 degree Fahrenheit, 1 or 2, maybe 1 or 3 degree Fahrenheit, and then I want him to achieve at least 100 degree Fahrenheit. Are you understanding? This is how we write expected outcome. Expected outcome मतलब क्या है? I am expecting. Okay, I am expecting this particular outcome. Outcome is the result. Okay, before achieving it, I will plan it out. Okay, I want this. Clear enough? We will be studying further in detail. Next is very important, intervention. We also call it as nursing order. Nursing orders, okay, are selected to aid the client reach these goals. Now, so in planning, what exactly we are doing is, we are planning the goal. Expected outcome is also called as desired outcome. Desired means this I really want my patient to achieve. Okay, desired outcome. And the third one is intervention. Okay, interventions are nothing but what all nursing care we are going to plan for our patient, that we are just listing it down. Okay, so hope so you understood just the introduction. Very important is the definition. Okay, so planning is deliberative. Deliberative means जानबूझ के, you are just doing it with deliberation. Planning is never just you're sitting, I will nicely plan. No, you are doing it with some purpose. Okay, deliberative, systematic. Now, why it is called, hopefully you understood deliberative. Systematic means why? Because planning is based on the assessment. Okay, so once you did your nursing assessment and once you formulated your diagnosis, it goes at the third step. That's why the systematic process. You can't just start with the planning, never. So you have to first complete assessment, then diagnosis, and then planning. That's why the systematic, okay, of nursing process that involves decision making. This is a very important word. What is involved in this process? Decision making and problem solving. Let me first clarify what you mean by decision making, because you are making decision of planning out the goal. You are making a decision of planning out the desired outcome. Okay, and the third thing what is written is the we are writing intervention. So intervention is also a decision. Now, for example, if my patient is having fever, okay, I saw it in the assessment, so I'm going to formulate a diagnosis called as hyperthermia. Okay, related to infection as evidenced by temperature 1 or 3 degree Fahrenheit. This is how I'm going to formulate the nursing diagnosis. Okay, and on that basis I will plan a goal. Let me take it to reduce fever. Okay, or okay, let me write reduce fever. Now the desired outcome I can write it down. Client will have temperature 100 degree Fahrenheit after 1 hour of administration of antipyretic, or after 1 hour of administration, or after 1 hour of providing tepid sponge. This is how I am going to write my desired outcome. But intervention, what I am planning, okay, I will be first assess fever, then I can give tepid sponge, administer tepid sponge, provide tepid sponge, administer antipyretic medication. Are you understanding? Antipyretic is nothing but to reduce fever. Okay, these are the intervention I am planning. This is a decision what I am taking for the diagnosis and the assessment. From that diagnosis and assessment, I am planning, okay, the intervention. So it's a decision. And problem solving. Why problem solving? Because we know that my patient is in problem. He's having some problem, fever, and I'm trying to solve it. That's why planning is called as a problem solving. Okay, we are involving problem solving process over here. That's why. Hope so you understood planning. Remember that first word which you need to write down, deliberately. That is, you are doing it with some purpose. It's just not for time pass. I want to reduce my patient's fever. I want my patient to become normal again. That's why I am planning for him. Okay, so that deliberative, systematic phase of nursing that involves two main things: decision making and problem solving. Okay, hope so the definition is clear. Next is types of planning. What do you mean by types? How at different stages we can plan out. The first type is initial planning. Initial means at the starting time. Okay, so the nurse who performs the admission assessment usually involves the initial comprehensive plan of care. For example, just now a patient got admitted and you have done a comprehensive detailed initial assessment of your patient, and then You just plan it out. Ki, haan, these are the problem, and then I will be starting with this all care. That is the planning. Initial planning means at the starting when the patient is just admitted and you have just completed with the assessment and then you are planning, then we call it as initial planning. For example, just now patient got admitted and is complaining of abdominal pain. Okay, his investigation has not been conducted, but now he is complaining of abdominal pain. So I can work on. So you are planning on it. Okay, hope so you understood initial planning. Next is ongoing. This is what we commonly do. Like for example, this patient, same patient who is admitted, and he now the second day or after just one day you are caring for the patient. So that will be called as an ongoing planning. Okay, it is done by all nurses who work with the client. It also occur at the beginning of the shift as the nurse plans the care to be given that day. For example, as you may start working as a staff nurse further after completion of your graduation, you will be working in different shifts. Okay, that is morning, night, evening shift. So here very important is that whenever we take over from our own staff nurses, you will understand that these are the problems of the patient and you just start caring. That is called as an ongoing planning. Once you know that this is a case or this is a problem, and then you plan it out. Ki, haan, I want to give this all care to my patient. Okay, that's called ongoing. Initial means just the patient is admitted and then you are planning out the care. That's initial. Ongoing means the patient is almost admitted and one day over and you are caring and you're taking over from your different staff nurses. That is also called as ongoing planning. And the last one is very easy. Discharge. Patient is going to get discharge. Now you have to give him, most commonly what we give is health education. We plan out the different health education topics for the patient. Why? Because if the patient is suffering with diabetes, then I will give him health education related to diabetic diet and what all food care he has to take on. Okay, so this is what? Example, just an example. Okay, so it is a process of anticipating. Anticipating means thinking. Okay, what all thing I have, now just now I said I have to think about what all thing I have to teach him. That is anticipate. Okay, and planning for needs after discharge. So it's a process of anticipating, planning for the needs. Once a patient is going to get discharged, you are going to plan it out everything and then give or try to implement. Implement will be the next step, but we are at the planning stage now. Okay, so hope so you understood the three types. Next is nursing care plan. This is very, very, very important. Okay, because literally nursing process you are going to apply. Okay, you are going to apply it, and we'll be discussing after completion of the whole nursing process one example. Here you just need to know that in the nursing process you are going to apply this all phases and try to give care to your patient. So we call it as nursing care plan. Okay, nurses are planning the care properly and then she is implementing it. So there are columns which I'll be showing you how to draw a nursing care plan. Okay, but let us understand what is a nursing care plan first. Very important, it's a written guide. Written, you're going to write nursing care plans. Okay, so written guide that organizes data about the client care into a formal statement of the strategies that will be implemented to help the client achieve optimal health. Now what you mean by this is, we as a nurse are going to write it down. All the organized data means ideally you are taking the assessment, right? You are taking the subjective data and objective data. On that basis you are formulating the nursing diagnosis. After formulating the nursing diagnosis, we are doing what? Planning, goals, desired outcome, intervention. So this all thing we are formally writing it. That's why it's a formal statement. We are literally writing it down, because whatever you are recording when you start working as a staff nurse is a legal document, right? So everything is recorded properly. Okay, of the strategies that will be implemented. So in planning we just plan out. हम प्लान बनाते हैं, but where we implement at the next step of the nursing process, that is implementation, means we will carry out the plan which you have formulated. Okay, so at this stage we just plan. Just at the starting when I gave you example that if you are planning to go for some vacation or you are planning to go for some picnic, you will first roughly plan it out with your friends or with your family members, and then you literally go to that place by deciding at many many options and what is best, what is according to cost effective, everything will be considered when you are going for such vacation. Same thing here also, okay, same thing here. Nicely we will plan before giving care to our patient, okay. So that is strategy that will be implemented, that will be, abhi kiya nahi hai, hum karenge, will be implemented, okay, to help the client achieve optimal health. Ultimately we want our patient to get well soon, okay, so he should get the optimal, the best health as much as possible, okay. The product of planning phase is a client's nursing care plan. So planning phase mein nursing care plan is very, very important, because we are literally, now here I will just tell you that we make such columns, okay, we make such columns where we have assessment, we just write A, when we have diagnosis, then we have goal, then we have desired outcome, okay, DOI, just write it down, then we have our intervention, okay, this is first, this is just one of the format, and then after that we write implementation and evaluation. Along with implementation we also write it down rationally, that is the reason why I am implementing that particular type of care to the patient, okay. Hope so you understood what is nursing care plan. Next is developing nursing care plan. The end product of planning phase of nursing process is a formal or informal nursing care plan. What you understand by formal? Formal means where you are just going to write it down and keep a record of it, like you know, na, formal interview or formal dress and all, okay. Informal, like for example when you are going and approaching your teacher, we call it as a formal communication. Informal, the way you talk with your friends, and informal. The same way here also, formal nursing care plan, here you are going to write it down, keep a record of it, and then you are going to implement it. Informal is something which you are going to keep it in your head. In your head means you are just planning it out, you are not writing anywhere. That is called informal nursing care plan, okay. It's a strategy of action that exists in the nurse's mind. Now sometimes in few good hospital, when you start working as a staff nurse, in few good hospital, you all keep a record of what all care plan or what all care you have planned for your patient. But in few hospitals, not in detail, nurses are writing everything. So how she is planning all the care is always kept in her head. She plans it out. This is a problem, I will care in this way. That is called as informal nursing care plan. Okay. The example is given. The nurse may think Mrs. Matthew is very tired. I need to reinforce her teaching after she is rested. Now, just an example. She saw her patient is getting tired. So she thought that I don't want to teach her now. I don't want to give her health education now. Let her rest. And when she wakes up, again, then I will approach her and give her health education. Okay. So remember strategies for action that exist in the nurse's mind. Okay. So informal. Next is a formal nursing care plan. This is very important. Formal is always written. We are always writing it down. The another word which is written is computerized. Few hospitals, if the most of the system are been maintained in computers, then can be computerized. But ideally, what we do most of the time is we write it down. Okay. So formal nursing care plan is always written. Okay, written or computerized guide that organizes information about the client's care. The benefit of this care plan is it provides continuity of care. Now, what you mean by continuity of care is, first of all, you understood that it is written. Likha jata hai. It's a written guide. And why? Because once we have that, today I cared for my patient. This is my care plan with me. That he had fever and I had given all this, planned all this treatment. And then I have also implemented, we are going ahead little bit, implement kar diya, and then I saw it was very effective. So I have to now, again, if the patient is having fever, I can use the same measure or I can make some changes. That's why once you have a written care plan, it guides you for the continuity of care. Okay, kal ye kiya tha, aaj kya karna hai. That is what it helps in a continuous, for giving a continuous care to your patients. Okay, so that is formal nursing care plan. Next is standardized care plan and individualized care plan. What you mean by standardized care plan is a formal care plan that specifies a nursing care for a group of clients with common needs. Example, all clients with pneumonia. So remember, standardized care plan is always a formal care plan which you are going to get it in books. For example, when you go in your second year, there are many medical surgical nursing books or other books also where they have given standardized care plans for a particular problem. For example, if you see, just you open up and see for heart attack, or we say myocardial infarction, or for heart failure, they have given a standard format. So that doesn't mean you just copy and paste and write it down in your care plan according to your patient. For example, in the standardized care plan, they will be giving many diagnoses and intervention. But what is applicable for your patient, that you can write it down. Yes, when you're writing your care plan, you need to take help or guide from books, because it's just a learning phase for you. You have not become expert in writing, right? So you need to refer standard care plan. Remember this, you are going to refer books for writing your care plans. Okay, so they are called as a standard care plan, which has already been given for each of particular diagnosis patient. Okay, that is pneumonia hai, or any other such diseases. They have already listed on various intervention and diagnosis and intervention. So you can choose from it which is suitable for your patient, जो आपके patient पे applicable है, that you try to use it. Okay, standardized care plan, hopes you understood. Next is an individualized care plan, developed to meet the unique need of specific client. Ideally, we are always preparing an individualized care plan. For example, one patient admitted with malaria and the next patient admitted with pneumonia, you are going to prepare for both the patient a different care plan according to their human responses. Human responses means what? What they are complaining of, or what they are telling you, what are their problems, okay, and what all thing you observe also. Huh? So individual care plan is always for specific client and need that are not addressed by standardized plan. Now remember, you are going to take reference of the standardized plan for preparing an individualized care plan. Okay, let me give you another example. There is a patient admitted with a complaint, with a medical diagnosis of, let me take dengue fever. Okay, now what you are going to do is, you know, this is a patient, this is the complaints of the patient, and you go back home and you refer books and see that for a dengue patient, these are the different nursing diagnoses, these are the different interventions. So you refer standardized care plan to make an individualized care plan. आप book refer करोगे and from that you make it for your patient which are related to your patient. Okay, there will be many diagnoses given in the book, but what is applicable for your patient, that you can write it down. Hope so you understood this. Okay, nursing care plan, we have seen developing nursing care plan. Next is very important, guidelines, like how you are going to write your nursing care plan. Okay, so first is date and sign the plan. Ideally, write it down the date. Like for example, today you are planning a care plan, so tomorrow you have to plan a different care plan. That's why date has to be there. You can also sign your care plan, that is at the end you can. But ideally, we just write date. Signing is done most commonly in our nurses' notes. Okay. Next is use category headings. Category headings, as I said you, that we write it down. Assessment, as I told you, we are going to make a big in a A4 size paper, you are going to draw like this, you are going to write it down, assessment, and in assessment you can write it on subjective data and objective data. This way you are going to always write your care plans. I'll be showing you this, then diagnosis will come, nursing diagnosis. This is how we write it down. So the main headings has to be there, and then you mention the content of it. Use standardized medical symbols and keywords. This is very important. So now this is specific to the planning of interventions. Okay, that is the care which we are planning for our patient. So there we need to write it down, this different standardized you can see. Turn and reposition. Q stands for every 2 hours. This means every 2 hours. Okay, that is we have to turn. That is, now for example, a patient who is bedridden. Okay, and I am thinking that he is a risk for pressure ulcer or pressure sore. So I will be putting one of the intervention, or I will be adding one of the intervention, that is turn the patient or turn or reposition the patient every 2 hours. So instead of writing this word, I will be using such symbols or standardized medical symbols or keywords I can use, that is Q2H. There are many such things which you can use. Please don't make of your own. Use a standardized medical terminologies. Okay. Be specific. This is very, very important. Be specific का मतलब क्या है? Be specific means what? That whenever you are writing any care, okay, so just don't write giving care to the patient. But what care you have planned? either mouth care, sponge bath, what care. Every time, whenever you're writing your care plan or whenever you're planning, you have to make it specific. Because if you are specific, then only you will understand what needs to be done. You should just write it down, give care. But what care? Next also, just don't write administer medication. But which medication? That you have to write specific. Now, administer medication, you have to see the patient's file and see what all medications he is getting related to, let me take it, fever. Okay, you saw that for fever, the patient is getting paracetamol. Then write administer medication, that is tablet paracetamol 500 milligram. Okay, this is how you're going to write specifically. Just don't write 1-2 words and just complete, but write specific thing. Okay. Refer, this is very important, refer procedure books. This is like you are just now learning how to write a care plan, so you need help, so please refer books. Okay, that is your medical surgical nursing books have all the main diagnosis or the main medical diagnosis which are explained in detail with care plans, and that will literally help you to formulate. We will be seeing an example, but then too please refer books for formulating the care plans. Okay. Next guideline is, this is very important, tailor the plan, tailor the plan according to the unique characteristics of client. What you understand by this tailor means you don't have to become a tailor over here, but according, tailor means, as you know, tailor kya karta hai? According to our body structure, he stitches the cloth. The same thing here, we are going to tailor according to the client's need. Again, if there are 2 patients admitted in the hospital, both are complaining of malaria, that is the medical diagnosis. But I said you that even if these 2 patients are admitted, the problems, the human responses can be different. One person complaining of fever, one person is saying, I have only body ache, I don't have fever. Are you under? Just an example I am giving you. So, it's very important, according to this patient's need, I will make a care plan. According to his need, I will prepare a care plan. Understood? So, according to the need of my client or my patient, I am going to prepare the care plan. Okay, that is the tailor the plan. Ensure that care plan incorporates preventive and health maintenance aspect as well as restorative. This is very important. Now, what you mean by this is, when you are planning for the care, yes, we are always concentrating on curative and restoration of our patient. Curative is when I just said you that I want to administer antipyretic, that is paracetamol. So, I am trying to cure my patient, which is a collaborative effort. That is, a physician has written and I am providing that medication. Now, this is a collaborative thing. But if you find that the patient is also diabetic and his blood sugar levels are not under control, so you can give him health education, right? And then you can also give him health education. Now, he is just diabetes. He is not suffering from blood pressure, but you know that he is obese, or he has an habit of taking more about fatty foods, then you can give him health education on preventive aspect of not getting hypertension. Are you understanding? So I can teach him that now your diabetes, you are at a risk of getting hypertension also. So try to see that, because you are having such sedentary lifestyle, you're not having control over your food. So please do it, because otherwise you are going to suffer with this. That is called as preventive aspect or health promotion aspect. Okay, so health education is most commonly used over here. Understood? So whenever you're planning your care plan, just don't concentrate on just caring, but also see that you also promote the health and prevent him from further diseases or illnesses. Okay. Ensure that the plan contains intervention for ongoing assessment of the client. This is very important. Huh? What do you mean by ongoing? I have seen this commonly done is that once you prepare your care plan, it should be on the basis of the problem the patient is suffering now. For example, you just went to your patient. A patient ke paas gaye and the patient is complaining of headache. So you have to plan a care plan related to the headache only. You can't plan a care plan on fever. Okay, so the intervention should be on the ongoing. Abhi maine kya dekha? Abhi, or what is the problem now? The recent problem, I will be preparing a care plan, not on a problem which is already over. For example, when the patient was admitted, he had a problem of fever. But now you are meeting your client, your patient, after 4 days. He was admitted 4 days prior. Pehle admit tha. Now you are meeting for the first time at the 4th day. Now he is not complaining of fever. So you are not going to make a care plan on fever. Okay, you're not going to treat because he's not having that problem. Ongoing assessment, abhi kya problem hai, you're going to prepare on that basis only. Please take care of this. I've seen common problem with the patient was had some problem, you're preparing, that is totally wrong. Okay. Next is include collaborative and coordination. This is commonly we are writing. Remember, whenever we are going to write the intervention, so first thing what we write is assess. Okay, yeah, in intervention also it's a format of writing intervention. First write it down, assess the problem. Assess the problem is assess the pain, assess the fever. Okay, this is what we write. What is your diagnosis? What is your assessment? On that basis we write it down. Next what we write is the nursing care. Remember, whenever you're writing your intervention, the first is the assess what we write, whatever problem you have identified. Then we write is a nursing care. That is, if the fever is there, then I will write provide tepid sponge. Okay, or every 1 hour, or depending upon every 15 minutes, depending upon what is the case or how much is the fever to your patient or whom you're caring for. Okay, just an example. And then you write collaborative at the end. Remember, collaborative cares are those care where a physician is writing an order for you and then you have to follow that. That is called as collaborative care. Okay, so all collaborative or coordinated care needs to be written at the end. Okay, remember this format of writing your intervention. So at the end I will write administer medication tablet paracetamol 500 milligram. Clear enough? Yes, this you have to remember properly. So we are including collaborative activities. Include plans for clients' discharge and home care needs. Now, this can only be done. What do you mean by home care needs or the client's discharge and home care needs? Means once the patient is going back to his home, the client is going back to his home, what all thing he has to take care of. So if you know your patient is going to get discharged, then please plan it out. Please plan it out ki what all care he has to take. That is commonly we write it down as a we write it on knowledge deficit. Okay, knowledge deficit is there related to particular diagnosis of the patient or related to lack of knowledge about the topic. And then we plan intervention, that is we teach him about diabetic, example diabetic diet or diabetic food which he has to take, or the food which he has to avoid as such. And then food care, which is very important for diabetic patient. If he is on insulin, then we teach him how to take or self-administer himself or the family member to give insulin injection subcutaneously. Okay, this all thing you have to plan it out. Okay, hope so you understood the guidelines for writing nursing care plan. Next we move on to the planning process. As we had seen in the assessment also, there were many steps in assessment. That is, first we have to nicely collect the data. If you remember all these things, collecting the data. Okay, we had seen all this in collecting, organizing, validating. If you remember, yes, and documenting. And then we move on to the nursing diagnosis also. In nursing diagnosis, very important is a format which has to be followed while formulating the nursing diagnosis. Planning process also has a particular the steps which are there. Okay, the first thing in planning is setting priority. What do you mean by priority? For example, if I say you that you have to listen to my lecture, or there is a second option for you to go for a movie. So depending upon if you are interested in listening to me, you will say no, I just want to listen to ma'am's lecture. Or if you say no, it's better that I can watch this video of ma'am's after some time. Let us go for a movie. So this is called as priority. Priority changes according to your perception or according to what you want at that particular moment. You feel like bored, you will say I will go and watch movie. If you feel interested in listening to me, you say no, let me listen to her, I can watch the movie later on also. Are you understanding? This is called priority. The same thing here also, we have to give priority to the care which has to be taken for the patient. For example, if a patient is complaining you of I am having breathing difficulty, मुझे सांस लेने में तकलीफ हो रही है. He's saying I am having breathing difficulty, and then he's saying I am also having pain at my hand. So what is the first problem I will be taking care of? The breathing difficulty. Okay. So whenever you are planning your care, plan the care in such a way that the first problem has to be treated first. That is, always we take it A, B and C. Okay. So remember, this will be seeing in detail, but remember this A, B and C. A stands for airway, B stands for breathing, C stands for circulation. ये पहला problem होता है हर बार. It has to be the first problem which has to be treated. Okay, then you go on for the next priority. Now when I said he's saying me difficulty in breathing, I will solve that problem first. Then the next problem he's saying me pain in the hand. That will be the second priority. The first priority is the breathing problem. Okay. So that is setting priority, we'll be seeing in detail. Next is establishing client's goal and desired outcome, selecting nursing intervention and writing the nursing order or the interventions what we write it down. So let us start one by one. Setting priorities. So it is a process of establishing a preferential order. Preferential means what you prefer. Okay, what you prefer. Now here remember, always and always prefer this ABC when you are caring for your patient. For nursing diagnosis and intervention. So in nursing diagnosis also we prioritize the first problem is the ABC problem and then the other problems. Okay, and interventions are also listed down accordingly. The nurse and the client begin planning by deciding which nursing diagnosis requires attention first, which second, and so on. So here in planning also you have nicely formulated your diagnosis. Now you are going to put it the first one which will come first. Yes, I am talking about diagnosis. Yes. So here you are going to write the first problem as he is saying me breathing difficulty. So ineffective breathing pattern may be related to mucus, much of related to excessive mucus and asthma, as evidenced by on auscultation there is at the lower lobe, left lower lobe, lack of you are not able to hear the sound, or there's a less lung sound heard, or there are crackles heard. These are the different adventitious breath sounds which I am talking about. You will be studying about it, don't worry. But here remember that always keep a priority to ABC. Okay, so the word is preferential order. क्या पहले आपको रखना है, because once you plan your nursing diagnosis order, then you can nicely plan your intervention. Okay. So instead of rank ordering diagnosis, nurses can group them as having high, medium or low. So you can just give it a grouping. You can group them. You know what are the high priority, as I just now said you. Airway, breathing and circulation is the highest priority for a nurse. Okay, now just imagine the person is just saying you difficulty in breathing and you are saying ठीक है पहले आपके हाथ का दर्द मैं solve करता हूँ. अरे if you try to concentrate on here, what will happen? Suddenly he will go up. So it's very important that you try to solve his difficulty in breathing. Okay, once he becomes stable, when he has no tachypnea, no dyspnea, okay, he is not having any difficulty in breathing, his SpO2 is normal, then you talk about solving the problem of the hand pain. Understood? Okay, so high priority, remember it is always this respiratory and loss of respiratory and cardiac function. So that is the highest priority. If a patient just now came in front of you and is fallen down, गिर गया नीचे, तो आप क्या करोगे? We'll always rush to the patient, we'll tap him. Hello, are you okay? And if he's not responding, we check the carotid pulse. Okay, and within 10 seconds we check the carotid pulse and respiration. No respiration, no pulse. Start with the chest compression. This is what, because for here ऐसा नहीं कि गिर गया हो कि गिरने दो, I will come after some time. No, you have to be very prompt. You have to be very vigilant, keen observer to see this thing, because your care can save his life. Are you understanding this? Okay, so high priority. Next is medium. What are the medium priority? Acute illness, that is any pain or any other complaints which are related to the illness or the disease. Okay, any coping ability. He's saying that I'm feeling very sad, I'm not able to cope up, or I'm feeling little tense, anxiety related to surgery. So that is what you are going to help him. Don't worry, this is what is going to happen with you. This is what is going to happen in the surgery. When you give him health education related to the topic, na, your anxiety, the patient's anxiety decreases. And the next is a low priority, normal development need or requires minimal nursing support. So that is low priority. If the person is saying, can you give me health education related to hypertension? So that is a low priority now. Okay. If he is having breathing difficulty, he is having pain in the abdomen, and third is saying give me health education related to hypertension. Giving health education related to hypertension will be a low priority, because breathing difficulty has to be solved first. Understood? Okay. So this is all about setting priority, which you should always write it down. That is the first priority diagnosis, and then plan it out. Okay. Setting priority, the first process. in the planning process. The second, okay, let me continue with setting priority. Nurse must consider following factors. So when we are planning for the priority, it is client's health values and beliefs, client's priority. Now here, remember, if the patient is complaining of difficulty in breathing, you should understand that and treat him. Is not think about कि आप, you don't go and ask आपको क्या लगता है मुझे पहले क्या करना चाहिए. Don't do that. Okay, client's priority doesn't mean that you are going to ask him, but consider his values, his beliefs. Okay, resources available to the nurse and the client. Urgency, this is out of all these things very important. Urgency means what is the need, what has to be urgently treated for your patient, that has to be taken care of. And medical treatment plan means what all diagnosis the patient had and the plan the physician has written, you need to take care of that. Okay, next is our second point in the planning process is establishing client's goals and desired outcome. This is very important. After your assessment, we planned our nursing diagnosis, and after nursing diagnosis, what we plan is the goal, desired outcome and intervention. So what is the goal? Okay, after establishing priority, the nurse and the client set goals for each nursing diagnosis. Now in setting priority, we have set the priority of the nursing diagnosis. Means what is the first diagnosis I will be, you have already formulated nursing diagnosis, but you are going to give it a particular hierarchy. This has to become first, not just hierarchy but preference. This has to come first, and then the first diagnosis, what will be the goal, what will be the desired outcome. Okay, so what are goals? Goals are always broad statement about a client's status. Broad statement doesn't mean a very big statement. Broad means covering about many things. Okay, like I say, maintain patent airway. Maintain patent airway means the airway of the person should be patent. Patent means there's no much secretion inside. Nicely he is taking in air and out. There are no other adventitious breath sounds heard or abnormal breath sounds heard. That is what. Okay, so it is a broad statement. We always say broad because it's covering up a bigger aspect. Okay, goals are always broad. Now, for example, you must have planned for your first year, I want to achieve in my first year BSc 70% mark. That is a broader one. That is a broad goal which you have planned. But for achieving that goal, you have to plan it out many things. Huh? That now, how can you achieve that goal? You are going to see that in unit test, in the midterm, you have to score well, or you have to score a particular percentage. Then only you can achieve that marks in your university. Are you understanding? So this is what goal is, always broad aspect, but desired outcome, we call desired outcome or expected outcome. Remember this desired outcome is also called as expected. I expect, okay, we expect many things from people, no? We expect many things from people. Here we are expecting that this should be the outcome of my care. Okay, the care which you are going to plan for your patient. Okay, expected outcome are more specific. This is very important. Are more specific. Observable criteria. Observable criteria means I can nicely observe. For example, when I'm saying that, if you remember, I gave you an example of fever. Client will have client's temperature will be 100 degree Fahrenheit after 1 hour of administration of antipyretic or after providing tepid sponge. So this is what this I have nicely written observable, because I can check the temperature. I can check the temperature on the patient with a thermometer and then see after 1 hour. Okay, so specific observable criteria used to evaluate whether the goal have been met. So what we ideally do is, after prioritizing the nursing diagnosis, we just write it down, the goal, okay, to reduce fever, just example, to reduce fever, and then I made the desired outcome. A desired outcome helps me to know that what I want to achieve at the end. Okay, so please write your desired outcomes. Okay, hope so you understood. Desired outcome is specific and goals are always broad statement. Okay, there's an example for you. Goal like effective airway clearance. Now, what will be the nursing diagnosis I must have written for this is ineffective airway clearance related to excessive mucus and maybe COPD is a disease, as evidenced by, again, you can hear crackles on auscultation. Okay, so this is what? This is the nursing diagnosis. On that basis, I have prepared a goal. The goal is effective effective airway clearance. The airway becomes cleared enough. Remember, with time you're going to learn how to prepare a goal. Okay, but remember, it's always short. It's always short and sweet. What the goal? Next is the desired outcome specific. We can see here the what I'm writing. Client will have. We always start with client. Client will have, that is, lung clear to auscultation during entire post-operative period. So I'm nicely writing it down that the lungs of the patient will be clear entire post-operative period after the surgery. As you know, so most common problem that the person can suffer with lung infection. So it's very important that we always try to tell him to take deep breathing exercises and coughing exercises, spirometer we give him. So by doing all these things, that I will be mentioning in the intervention, but this is what I want to achieve, that his lungs should be totally clear. Okay, cleared means that is, there is no amount of any secretions or no amount of infection found. Okay. So why are we writing goals and desired outcome? Why I said you that you have to plan a goal for you? Yes, please, my dear students, do plan goal for yourself. Unless and until you plan a goal, I'm talking about your personal goal that you want to achieve 70% in your first year. Okay, you want to pass first year with this much percentage. When I'm saying that you have to plan this goal, because if you have goal in front of you, then only you work on it. Otherwise, what will happen? You will just carry your bag, go to your class, sit in your class, go back. Nothing. You don't know what you are doing and why you are doing. So please have some goal in your life. The same thing here also. Why we are preparing goal? Because that can guide the nurse. Okay, that can guide the nurse to achieve or give the best care to the patient. Okay, so provide, this very important word, direction. It helps us. As a nurse, it helps us. Okay, so direction for planning nursing intervention. So when I'm planning the goal, when I'm writing the desired outcome, it helps me कि what all intervention I can write it down for my patient. Serve as criteria. This is very important. Serve as criteria for evaluating client progress. What you mean by this is that once I have laid down the desired outcome, like I want to achieve within 1 hour, the fever should be reduced. I am writing it down 100 degree Fahrenheit after 1 hour. When I am writing this, I will be checking after 1 hour how much is the fever. Okay, so it helps me at the last stage, that is evaluation. Okay, when we are seeing the example, you will understand more better. Serve as a criteria for evaluating client progress. Enable the client and the nurse to determine when the problem has been resolved. This is also next important point. For example, when I checked the patient's fever, temperature, I saw that it was 98.6 degree Fahrenheit after 1 hour. So I can say, arey wow, so nice that my care or the nurse's care, the nurse which has given the care has been effective. So now I don't have to think about this problem. So it is resolved. Okay, solved. The problem is totally solved up. Okay, so it helps me. Next is help motivate the client and nurse by providing a sense of achievement. This especially, it motivates the nurse. Once you have planned your desired outcome, okay, that this is my goal and this is my desired outcome, when you achieve it by giving care, when you are going to implement it in your next phase, the 4th phase, and when you evaluate in your at the last phase, when you evaluate and see, hare, mere care ki wajah se the patient has been recovered, you feel really good and you feel motivated to do your best. Okay, but that doesn't mean you don't get demotivated if your care, the patient has not recovered. Don't worry. Sometimes it takes time. It's not just one day the patient is going to get healthy and go back home. It takes time, but see to it that the patient coming to you should be getting well soon. Okay, hopes you understood the purpose. Next is the types of goals. Okay, so first we saw was setting priority, then was preparing goal and the desire, establishing goals and desired outcome. In that only there is this point written that what are the types of goal. The first type of goal is short-term goal. Okay, short-term means for a shorter time period. So there's a short-term goal and a long-term goal. Okay, so are useful for clients who require healthcare for short time. Outcomes are achieved in few days or weeks and it is measurable, client-centered, realistic and accompanied by target date. Now here you can see client will raise right arm to shoulder height by Friday. Now it's just an example which is written. For example, a patient must have undergone some surgery and then we are expecting his hand should be raised. Okay, his right hand should be raised above the okay, that is above the shoulder, okay, by Friday. So this is, I'm writing specifically. Must be that Monday the surgery must have happened, and slowly he could have raised his hand. That is what. And always short-term goals are prepared. Now this, I said like 1 hour may I want that the temperature should go down. So that is a short-term goal. Okay. Now short-term goal is even when you are planning for yourself, you have made for the whole year, you have made the long-term goal you have made. But short-term will be in order to achieve that this unit test I will score very good marks. That is a short-term goal. Unit test means I'm talking about your class. Okay, the unit tests which are there, I will score good marks. That is a short-term goal. But long-term goal, that I will pass in first year BSc with this much percentage. Always aim higher, my dear students, so that if you aim higher, you will land on it or above it. Okay, don't worry that you will go down. It will always be nearer to that particular percentage. Okay, hope so you understood short-term goals. They are always for short time period, and outcomes are always achieved within days, few days or weeks. And they are, this points will be seeing what you mean by measurable, client center, realistic. Measurable का मतलब है क्या हम उसको measure कर पाएंगे? Can we measure it? That is, for example, when I said about fever, yes, I can measure with temperature, with a thermometer. I can measure the temperature with the thermometer. The same thing here also. Client will raise right arm to shoulder height. Okay, so shoulder height is raising his hand. Now this I am seeing, I can observe it. That is called observable and measurable. Okay. Next is client center. Remember, the goals are always planned for the patient, not for yourself. You're not planning goals for yourself. You're planning for your client. That is client centered. Realistic. This is very important. I can't just write it down now here. If Monday surgery has been done and Friday I'm writing that he should raise it not only above the shoulder, above the head. Okay, so that is something is not realistic. Okay, again, I can give you a simple example. You can't write for yourself. You can't prepare a goal for yourself saying that I will score 100% in first year BSc. That is not possible. It's not realistic goal. Nobody in the history has scored 100%. Okay, that's not realistic goal. The same thing here also. Whenever you're planning goals and desired outcome for your, especially goal for your patient or client, see to it is realistic. Realistic matlab real hona chahiye. It should not be just a vague something you're writing it down. No, something which should be achievable. हम achieve कर सकें, that should be your goal. That is called as realistic goal. Now when I said that I want to achieve that the fever has to got, when I said to reduce fever, that is achievable. I can't say that it is going to, the fever is not at all going to go away. It's never going to happen like that. Okay, with treatment, with care, the fever can be reduced. Are you understanding? Next is long-term goals. So are often used for clients who live at home and have a chronic health problems, like mentally ill patients who are there, they have chronic health problems, right? And few patients who are admitted for a longer period of time in the hospital. Desirable outcome takes weeks or months to accomplish. The client will regain full use of right arm in 6 weeks. Now I'm saying that he can nicely use his arm within 6 weeks. Okay, that is the long term, for a longer period. Remember, ideally we are always preparing short term goals because you are caring for your patient for maybe 1 week or maybe 4 days, and then you go and care for the next patient, right? So here we always plan short term goals, but when you are caring for some patient for a longer period of time, you are for a longer period in a particular ward or ICU, then you can plan long term goals. Okay. Next is very important that goals are always patient centered. Client centered means we are always focusing on our patient. Okay, the goals are prepared for our patient, not for ourselves. Okay, and they are smart, as you all are very smart, my dear students. So same thing here, goals should also be smart. Smart means S stands for specific. This is very important. Specific लिखना है आपको. Up to date, what you want to achieve. Now, for example, you have prepared a goal. I told you to prepare a goal. So you are nicely writing that I want this much percentage. The same thing here also. What you want to achieve, that you write it down specifically. So this can be applicable for your desired outcomes also. That you write it down specifically. Okay, what you want to achieve. Next is measurable. Measurable means what? I can measure it. Yes, I can measure it with different instruments, or I can observe in my patient. That is called as measurable. Okay, observable is also one more word. A, actionable. क्या हम achieve कर पाएंगे? Can I achieve? That is called as a realistic one. It should be real. It should not be just a vague something you are writing it down. I can't write it down to reduce fever within 5 minutes. Not possible. You can't reduce fever within 5 minutes. It's impossible. Fever reduces slowly. It takes time, na? That is not attainable. Within 5 minutes, not at all attainable. And within 5 days, that is too far away. Within 1 day only, I can reduce this fever. Yes or no? By my care. Are you understand? That's called attainable. Next is relevant. This is a very important word. What do you mean by relevant? Related to my patient. For example, my patient is having pain. Let me take it pain. Okay, he is complaining of abdominal pain. So I will write it down: acute pain related to infection and appendicitis. Appendicitis means inflammation of appendix, as evidenced by patient verbalizing 8 on a scale of 0 to 10. 8 on a scale of 0 to 10 मतलब उनको मैंने pain scale दिया. 0 is no pain, 10 is very severe pain, and he's saying 8 on a scale of 0 to 10. This is a nursing diagnosis what I formulated. For this, what should be the goal? The goal should be to reduce pain. Okay, the desired outcome will be the client will have reduced pain. The client will verbalize pain 4 on a scale of 0 to 10 after 1 hour of administration of analgesic. This is the desired outcome what I am going to write it down. Are you understanding? Now here what is important is that whenever you are planning your goal, you can't write it down as what I was saying was, you can't write it down as that pain related problem. You have to write reduce pain. I can't write to reduce fever. Okay, when the problem is pain, I can't write reduce fever. So that is not relevant. Relevant means not related to the problem of the patient. Okay, the next is time bound. So when I said that after 1 hour in the desired outcome, and in the desired outcome, that is after 1 hour, a specific time when you write it down, that shows yes, I can achieve it. Very important other word is observable. Observable का मतलब है, can I observe on my patient? Yes, you can observe. But see to it that you should see that I should able to observe. Like when the person is complaining of nausea, you can, nausea means ulti jaise hona, that is nausea, that he only can tell you, subjective. But when you see him vomiting, that is observable. Okay, hope so you understood what is goal and what are SMART goals. Okay, please prepare SMART goals for yourself. Okay, so types of goals are short term and long term. Commonly we use short term goals.